Safety and quality. Radiation safety, firing on all engines. In January 2013, Cook Children's became the only facility in Texas and the southwestern United States to offer children I-131 MIBG therapy to treat neuroblastoma tumors and metastases. MIBG is offered through clinical research trials that are currently ongoing at Cook Children's for those that meet criteria. A rare therapy for a rare disease, the MIBG treatment is injected intravenously, during which time the patient becomes radioactive. After the infusion, the patient remains in radiation isolation for 5 to 7 days. Because of the radiation MIBG therapy requires, we wanted to make sure that our staff stayed as safe as possible. So we created special facilities for radiation safety and a collaborative approach across multiple disciplines. However, since Cook Children's was one of the first to use MIBG therapy, there were very few pediatric centers to model, and standardized radiation dose guidelines for protecting caregivers did not exist. This got our wheels turning. We decided to research other institution experiences and elevate workplace safety to be a critical focus as we began providing this unique treatment. The Millirem is the dose unit to measure the effect of radiation on the body. Based on a study published by Boston Children's Hospital's Department of Radiology in 2013, we learned that the nurse's average exposure per MIBG patient was 40 millirem. Since this number is the only comparison for measuring radiation exposure, 40 millirem became our benchmark. So how much is too much millirem for a person? How much radiation is an average person exposed to typically? For perspective, average radiation exposure for a person is 620 to 670 millirem per year. The following is a list of exposure counts from common radiation sources provided by the EPA. Based on this study, we wanted to ensure the staff caring for these patients received the minimal radiation exposure of 40 millirem or less per case. To achieve this goal, all MIBG nurses went through extensive training. All instructions, guidelines, checklists, and criteria are now included in a single policy that acts as a resource. Every MIBG caregiver adhered to the safety precautions, and after treating 36 patients in 2 years, exposure has been consistently below 30 millirem for all direct care nurses. The following graph displays the number of exposures greater than 1 millirem for the 2 years we've been providing this therapy.